Hey guys, Dr. Kirsten Wishloff here. This is a special episode of the Doc Wishloff Podcast. I am giving you a behind the scenes of my 4-day fix program for foot and lower back injuries. This is the opening lecture from the 4-day fix. You can still join and get all the goodies for free until December 16th. So if you are listening to this podcast and you're like, I'd like to join that program, show notes, we're going to have the registration link. Get in there. You'll have access to that until December 16th. With that being said, there are some visuals that can be helpful. So if you're listening to this on like Apple Podcasts or Spotify, you might want to jump on YouTube and watch the video itself because it's going to give you a little more context for what I am talking about. Let's get those foot and knee injuries sorted out and see how they are part of the bigger picture. Enjoy this one. It's going to be fun. Really what I try to use these courses for and these 4-day fixes for is to start to get you closer to the actual cause of your problem. Because most of the time people are starting from the place of the location of the pain. We're going to talk today a little bit why that could be a problem when it comes to resolution, because the place where you are in pain might not actually be the place that needs your attention. So we want to talk about how movement is connecting through the body as a system, and we also want to make sure that you're directing your attention to the right fixes. So that's why we do these 4-day fixes. And then if you guys are interested, I'll chat through also what my 8-week program looks like, because we kind of leave no stone unturned. Over the next 4 days, we're really going to focus in on stuff that's going to help improve the motion of your foot and your knee. So for those of you guys who have come in here with foot and knee pain, this is what we're going to solve. So I will have the chat box open. I'm going to get into a presentation. So the presentation today, we're going to chat a little bit about the biomechanics of the foot, the knee, and how they kind of work with the rest of the system. And I'm also going to give you guys a little rundown of how the program is going to work over the next 4 days. Sound good? Perfect. Okay, cool. Let's get it rolling. Hey, Ruth. It's good to see everybody. Feels nice. Everybody's back. Let me get my screen share going here. I do have a video that was questionable in terms of it working because we changed the light fixture while I was trying to make this presentation yesterday. And I was just trying to sort out that video right now. So it may or may not work, but I'll zoom out if it doesn't. Cool. Let's get it going. So again, I'll do a little presentation. We're going to do some anatomy stuff. For those of you guys who are practitioners, I've got exciting news. I'm going to do more practitioner stuff in the new year, but I am going to try to teach this at the level of client. So my hope is very approachable. So we're going to touch a little bit on some anatomy, some biomechanics, but I want to keep it pretty approachable. So we're going big picture. I don't want to get too far in the weeds. If you are a practitioner with questions, what I would say is you can pop them in the Facebook group. You can also pop them in here. I just may or may not answer them. I just don't want to lose, I don't want to lose the, what is it? Forest through the trees, trees through the forest, whatever that statement is. Yeah. Okay, cool. So let's get into it. This is the first one we've done for foot and knee. So we're going to cover some new stuff that hasn't been in my other 4-day fixes. So welcome. So you're in the right place if you have kind of an injury that's ongoing. It's not getting better. You're just like stuck. You've done the stuff you can Google. You've gone and seen practitioners. You can't figure it out. So that would be one type of person. You could have an old injury or previous surgery. You could have something structural going on and you're noticing that it's just stagnant. You just like can't get improvements in it. Another type of person that this workshop is good for is you always get the same type of injuries as soon as you increase your volume. So as soon as you train harder or as soon as you walk further, as soon as you do more, the same spot is always getting hurt. If you've been trying to do it yourself and you haven't really structured a plan, this is also going to be a really good way to learn how to structure a plan. A type of person that I like to draw to the forefront is someone that has made their life and their activities smaller, because that is a lot of people. They go, my knee is not that bad. I just stopped running. Or my knee is not that bad as long as I don't do this. To me, that does not mean it is rehabbed. Even if it doesn't hurt when you're just sitting around, as soon as you're not pushing and growing into those joints, they're getting weaker. That's unfortunately just what aging is. So it's not actually great. Even if you don't feel pain when you're at rest, if you're making your life smaller and the amount of things you can do with that knee before it's painful smaller, or the foot or whatever it is, that becomes a really big problem 10 years down the road. So we don't want to accept that as kind of our fate, that we just stop doing things because of pain. We want to understand why that pain is happening, and that's what we're going to do over these next few days. Tying into that one, feeling like you're getting slowed down or just getting older, there are certainly changes that happen as you age. However, those are global changes, right? So if you are having like pain on one side versus the other, that's not an age thing. Sure,
Ooh,
maybe the rate that you can recover or the way that your body just feels as a baseline or the elasticity you have can change. But if you have a problem on one side of your body and not the other side of your body, that's movement related, baby. That's not metabolism. That's not aging. So we got to figure that out. And oftentimes, as you get older, you've run out of ways to cheat your movement. You've used up a lot of your compensations already. And now you got to go fixing stuff. You can't just hide. And also, I think a lot of people run into a place where they're like, I feel like I'm just wasting my money getting treatment. I feel like it's not happening for me. So, if you are any of these people, this workshop is for you. And if you feel like you're ready to put the work in, ultimately, all of my online stuff is you doing the work and me giving guidance. So, hopefully, you guys are ready to put in some work. And I want to make sure that you're targeting the areas that are going to give you the biggest bang for your buck for all the effort you're putting in. For those of you who are new to me, my name is Dr. Kirsten Wishloff. I am a chiropractor. That's what gives me my doctor title, but I have previously been an athlete. I played two different sports at a university level. I tore my patellar tendon. I fractured my back. I ruptured my rotator cuff. I've done it all, you guys. I hurt myself so many times, and I could show you how to get back. After hurting myself as an athlete for a number of years, I worked as a personal trainer, yoga instructor, strength coach. I also implement medical acupuncture. I was a yoga instructor. I've been thinking about movement for a very long time and specifically performance care. So I work within settings where people are hurt within an activity. So I make movement feel better and figure out the strategy that's going to work best for you. So a little background on what I do. I specialize in unwrapping these compensations that we're going to figure out over the next 4 days. All righty. So, a lay of the land of this 4-day fix. You are on the live call. So, check mark day one. We're going to talk on the next slide about the scorecard, but that is going to be one of the marks on the scorecard. If you are live, give yourself a check mark. We're going to talk about the strategies that we're going to use over the next 4 days to figure out what's going on with your foot and knees. So, these 4 days are going to include 3 mini workouts. So, each of these 3 mini workouts is kind of targeting some sort of compensation that's really common within foot or knees. So, we'll have a day one, day two, and day three. Any point in time you can get them done. Ideally, you can get them done before Thursday. Each of them is about 10 or 15 minutes. So those are kind of the primary things. If you only have time to do one of these kind of checklist items, do those 3 mini workouts. Those are going to show up. I'll show you what those look like at the end of the presentation. But those are kind of key because they're going to give us information about your injury. The other thing that I add into these workouts is relief exercises. So you'll see a landing page, it'll have the day one workout, and it's going to have two different relief exercises. A big part of what I want to give you guys is the tools to create pain relief so that you can safely load the parts that hurt. The relief exercises are not going to be the same for everyone. What is relieving for one person might not be relieving for another. So I gave you guys a bunch of different relief exercises to test out throughout this program. I'm going to talk a little bit also in this presentation about what pain means and how to kind of approach it. So we'll talk through that, but we have relief exercises just for some transitional kind of pain relief as we go through these exercises. And then lastly, on Thursday, we're going to do a debrief. So we're going to take that scorecard. We're going to talk about what we did over the last few days, and then we're going to go over what that means for your body. And then on Thursday, I'm going to open the doors to the Posture Revival program starting in January. We are doing this 4-day fix in December so that we can just hit in stride into the new year, getting into that Posture Revival program. So that is the plans. This is what your scorecard looks like. I will touch on this again at the end, but you should be able to download that off of the program page. We're just gathering some information about the injury. We have workout 1, 2, 3, and we're gonna talk today about what you're gonna write on those. But each of those days kind of represents a different pathway of movement or compensation pattern that we're gonna be talking about. So I'll jump into the scorecard in a little bit more depth at the end once you guys kind of have some context of what we're talking about. But hopefully all of y'all have found that so far. And again, we'll chat and we'll open up the chat again after I go through what we're talking about today. So that is what is coming up in the 4-day fix. Let's get into what we're talking about. So, I specialize in taking an interconnected approach to solving injuries, which means instead of being like, oh, you have a bad foot, we're going to look at how that foot moves with the rest of the system and how that movement is interconnected. So, everybody came here because they have some sort of injury or concern within their knee or their foot. That's where your brain goes, and that's kind of where you're like, this is my problem, which makes sense. That's what it's there for. It's there to give you a signal. So this pain is giving you a signal, but it doesn't necessarily signal that that is where you need the intervention. So what you might have tried prior to jumping into this workshop is like, I did the stretching thing, I did the like more mobility thing, I did the isometric thing. Like I've been trying all of the checklist things that I can figure out to do, and that I've been given by a practitioner. But for the most part, all of them have been targeting the site of pain, and they haven't been discussing how all of these pieces work together. And that's what we're going to try to accomplish over the next 4 days. So, this workshop is all about teaching you how all of these pieces connect and work together so we can shape shift how movement flows into your body. In some instances, we're going to get complete resolution. When your pain point is a compensation, it's going to be complete resolution. For some of you, you're coming in here with old surgeries, with old past, pain point, past damage. That's okay too, because this system is going to show you how you can redirect forces around something that is structural as well. So keep that in mind as we talk through the flow of movement in here too. Sometimes it's not always about making all of your movements perfect. It's about teaching your brain and your body how to redirect forces more effectively. So we take this approach because most injury systems are directed at this type of injury. So this is called a traumatic injury, like my little stickman. I'm becoming known as like the stickman lady. I like a stickman. In these types of injuries, the mechanism of what has hurt you is very straightforward, right? This is external force. Someone has come in and blew out your knee. The force that created the damage in the tissue is outside of your body and therefore is gone when this person is no longer kicking your knee. So you don't have to go chasing down the mechanism of the injury because it was outside of you and now it is gone. So then it becomes really straightforward, right? You're like, we need to rehab the knee. We need to make sure this tissue heals and gets stronger. However, there is not a great system to discuss injuries that are occurring as the result of your own movement. And that's what we're going to be talking about in this workshop. So these are called atraumatic injuries, meaning there is not an external mechanism creating the injury. It is something within yourself that is creating this damage, this injury. So what we have to go searching for is the reason that area is getting overloaded, which is also, again, why I bring up the idea that you can't solve the pain at the site of the pain, because the site of the pain is where the overload has occurred. It's not necessarily the cause of the overload. And that's why we want to look through the entirety of the system to decide why this area is under so much stress. A really good example of this, and I highlight this on here, is plantar fasciitis, because rarely is plantar fasciitis a one time, maybe you tweaked it one time, but it rarely is like, oh, this came out of nowhere. It's always like fluctuating, and you're like, suddenly one day it started hurting. It's a slow build because of how your body is distributing movement. And so that's why we need to go through this entire system of checklists to make sure that we've targeted all of the appropriate structures so we know where force is starting to accumulate. So this is a really good example of a client. We'll talk through hers, I think, a little bit later in the presentation, but we can essentially change how movement flows through the entire system by changing just any of these pieces. So if you have knee pain, we can change the position of your shoulders, your head, your foot, and have a change through the entirety of the system. So we want to get comfortable in understanding how all of these pieces are interconnected, and we want to improve how that motion is flowing. If we run into stop points, right? You're like, I had a knee surgery, I can't rotate this knee. That's okay, because we have a bunch of other places that we can look to improve the movement or flow more movement to, so we don't have those same overload points coming up. So the beauty of this and why I love it, and especially within high performance like sport care, is you can get someone back out on the field or you can get them back into their sport by just modifying how forces are pouring through your body. And yes, we can have time to allow things to heal, but ultimately we want to be able to heal and get stronger at the same time without overloading those same points. So we do this in the posture revival program. The 4-day fix is going to cover topics specific to kind of knee and foot. And again, we're doing like a little pieces of things that are most common with knee and foot injuries. But in the posture revival, we go through every single one of those pieces to make sure that we have left no stones unturned. So I'll talk through a couple client cases because I like to bring these up just because sometimes this idea of working through your body as a full system feels kind of abstract. So this was a client who had chronic ankle pain. He is a snowboard instructor. He does a lot of jumps, landing the jumps. Year over year, his ankle was just hurting, and he was doing all of the ankle things and all of the ankle strength. We went through the posture revival program. We did all of the checklist items, and we actually learned that his ankle problem was a visual and vestibular problem. That balance system in his head was creating instability at his ankles. So how he actually solved his ankle problem was improving the function of his neck and visual system. So I'm bringing up some case studies so that you guys can kind of see why I'm bringing certain things up in this 4-day fix when I'm asking people how their balance is, how their lower back is. All of these things are contributing to why you're getting certain types of pain. This is a client who came in with plantar fasciitis. She is a firefighter. She had right foot plantar fasciitis. She was doing all the toe scrunches, all of the foot stuff, everything for her foot. We traced it back to an old AC joint injury on her left shoulder. So we corrected out the motion of her left shoulder, and the plantar fascia pain on her right foot went away. This is, I bring up the idea that, again, you're making your life smaller because of injury. So Jody actually has started working with me. You may have seen her in some of the chats or some of the emails. She had an old ACL injury, and she's a dental hygienist. So she was getting all of this neck pain. Through the posture revival program, we traced it back to her ACL injury. We didn't change that structure of her knee, right? It's been surgically repaired. However, we adjusted her foot pressure and her neck pain went away. And I highlight as many of these as I can so that you guys can get a sense of how we change things. This is a client who had hip bursitis. We changed her foot pressure and her hip bursitis went away. She was doing hip exercises all the time. And we were like, let's look outside of the pain. We got to figure out what is causing it. One or two more. Here is a knee specific one. If you guys are coming in with IT band issues, this is a client who did my revival series program. We traced her IT band issue back to her big toe, right? So we're tracing these things through. I want you guys to get out of this habit of chasing the pain and get into the habit of figuring out why movement is hurting you. And that's what we're going to do over the next 4 days. So let's get into it. So a big focus of this workshop, and again, these are kind of pieces out of the posture revival program. The focus for this workshop is going to be foot pressure and how your foot moves within the system and the position of your pelvis. So these are going to be the two kind of key areas we focus our energy on as we flow through this workshop. When we look at movement in general, there's 3 planes of motion. So if anyone's ever taken like physics lesson, you got forward, back, side to side, and then you have rotation. So everything in this 3D world is in 3D because it's 3 dimensions. So all of the movement in your body exists in 3 dimensions. I'm going to place an extra highlight for the purposes of this 4-day fix on transverse or rotational motion. And I'm going to explain why that is when I show you the bones of the foot. But rotation is going to be the key to resolving a lot of problems when it comes to your foot and your knee. And that is where we're going to place a big amount of focus. But recognize that all 3 planes of motion exist, and we touch them on the full program. But I want to make sure that you guys know the areas to highlight. I will take a moment, I will take a breath, and I will say this before I get into the biomechanics. If you only take one thing out of the workshop, it should be that foot and knee injuries occur when you can't control the rate that rotation is flowing through your leg. That's it. That's the magic statement. Take it, run with it. I'm going to put context around it right away. But people underestimate how much rotation needs to happen at their foot. And so often that leads to knee problems and foot problems. People think of their foot as this thing that goes forward and back. She rotates. She does lots of rotation. And if it doesn't, it shows up in your knee and it shows up in your plantar fascia. And that's what we're going to talk about over the course of this workshop. So I don't want to go too far in the weeds. If you guys like this stuff and you want to learn, Google foot bones. Google the bones of the foot. Google them. I'm going to keep it really simple because your foot essentially breaks into two columns. I'm going to show you that on the next page. So your foot has a bunch of bones. And the reason it has a bunch of bones is because it twists and turns and expands to accommodate for the rotation that comes from above in your body. When it is functioning effectively, it can take rotational forces from the top and control them, and it can initiate rotational forces back up. If either of those two rotational forces coming either from your hip or your torso down or coming up off the ground are not working, the spot it lands is your knee. And that is why knee injuries are so common, because dysfunctions in rotation anywhere through those head, shoulder checklist, that full body checklist shows up in your knee. And so that is why we need to first start with the foot, because it has one of the biggest capacities to control rotation in your body. And most people are sleeping on it. Most people do not realize that their foot should have as much movement as it does. So to simplify the bones of the foot, we're going to break it into two columns. So your foot, this is your foot from the top. I'll ask you guys in the chat here. Has anyone not heard of the word talus? Do you ever heard of a talus bone? Is that new? Is that new info? Brand new? So you have your heel, and then you have your talus bone. Your talus bone sits on top of your heel. This was the video that, I don't know if it worked or not. We'll show you in the next one. So this is your talus. Your talus bone sits above your heel below your shin bone. It connects onto no muscles at all. It is floating around and flying and distributing rotation. This is the bone that creates the appearance of a flat foot or a heightened arch. It is the bone that creates the arch of your foot. Oh, okay. I think my video worked. Okay. So here's your foot from the side. This is your talus, and this is your calcaneus. There is movement between these two bones, and this movement provides rotation above. Hope my video captures the right spot. I'm going to break out of here and show you guys a video of this a little slower. So these two bones is what we came to talk about for the next 4 days. Get familiar. Heel bone, talus bone. These two bones have to rotate over top of each other. I'm going to exit out of this and find this video so that it's a little easier. I actually have the bones of the foot somewhere, but I didn't bring them today for some reason. So when we are seeing that bones of the foot rotate, let me pull up this video here. There we go. So what we can see before I start this video, I'm going to make sure you guys see the screen. Yeah. What I want you to notice is this line. So your foot is broken into those two columns that I said before. So don't get overwhelmed at how many bones there are. There's lots of bones, but essentially you have two columns of bone in your foot. When your shin comes forward, this talus needs to rotate inward.
The orientation of the sub.
So if we watch here, this foot movement, give me this foot movement here. When your shin comes forward, this talus needs to rotate in like this. Every time your knee comes forward, it needs to rotate in. The reason it needs to rotate in is because this unlocks movement at your foot. If it does not do this rotation in, or if it is already down, you can't control the distribution of rotation at your foot or knee or hip. That is often why people blame flat feet for many problems. The problem is not that the foot is flat, the problem is the foot doesn't move. We need that arch to be able to be a big part of how motion is flowing. And I'm going to show you guys that back in this presentation. Where did we go? Here we go. So even at the very start of any sort of foot movement, we need movement of this talus bone in. So when my knee comes forward, the dropping of the arch is that talus coming in, and the lifting of the arch is the talus going out. So knee coming forward is internal rotation at that talus, right? We're pointing the talus in. And external rotation is that talus pointing out. Many of the assessments that I watched do not have very dynamic feet. And that is a good thing for you guys if you are in pain, because we have a place to add movement that's going to take stress out of the pain points that you are experiencing. So I'll play this one more time because what is going to happen and what we're going to practice in the workshop and the exercises that we have is this lifting and lowering of the arch, because as soon as your shin comes forward, we need to have dynamic movement of this talus. It needs to turn down and in. So even though it looks like you're moving forward and back when your knee is bending and straightening, you're actually generating rotational forces. So in order to safely and effectively distribute that rotation into your foot, we got to get comfortable with 3 points of contact. So I put these guys here, 1, 2, 3. This number 1 is anchoring that medial column. If I take us back to this picture, medial column is this one that connects onto that talus that's really dynamic and it's twisting and it's moving. This is the longitude, that arch of your foot, the longitudinal middle arch. So the arch of your foot coming up and down is this column. And the lateral column creates kind of this anchor of stability. So what we basically want to see is pressure through all 3 of these points, but we want to allow the foot to have this arch coming down and arch going up. We don't want to feel like we're changing pressure through these points as we're going through movements. We want to feel like those 3 points are anchored and that we're allowing the foot to rotate to keep pressure even through these 3 points. If we can't pressurize these 3 points, it's going to show up as a problem at your knee. It's going to show up as a problem at your hip. And it's also going to change the tension in your plantar fascia. So if anyone is in here with plantar fasciitis, these 3 points are critical for your life, because if we're not pressurizing these 3 points evenly, you're going to get different tension lines sitting in your plantar fascia, creating overload points. So how does this look higher up in your body? So when we have more pressure pouring through the inside edge of your foot, this creates internal rotation at the leg. Internal rotation at the leg tips your pelvis anterior so that you don't fall forward. The next reciprocal motion up is your chest lifting up. And then your body does anything it can to keep your eyes level. So this feedback loop can happen from the ground and come up, or start up here and go down. If we're experiencing maybe some lower back issues and your body has pulled into an anterior tilt as a means of guarding that lower back, this can show up as a change in your foot pressure and can change the rotation through the entirety of the system. This pattern of movement puts more pressure through the inside edge of your knees. So if you are someone experiencing pain on the inside edge of your knee, if you're experiencing like a pinching sensation at the front of your hip, if you're getting pain at the front of your knee, or if you have tendon issues, Achilles or patellar, this pattern is very common because of how forces are distributed. And so if we can change this foot pressure pattern, there's a good chance we take a pressure off of these hot spots that can show up from this. The same goes for the opposite. So if you are someone who has a tendency to load through the lateral side of your foot, this represents external rotation through the limb. This also represents a posterior pelvic tilt and the dropping down of the rib cage. So this is kind of like this cascade of compensations that comes through the system. This posterior pelvic tilt position and the external rotation reduces your capacity to use your foot to distribute forces. It also decreases your effectiveness at your actual hip to absorb forces. So the injuries that start to accumulate from this pattern of load often are like IT band, lateral ligaments of your ankle, anything where it's like a passive structure, meaning like ligamentous stiff tissue. This strategy loads those tissues probably more than they would want to be loaded if you are someone with these types of injuries. And so we can change anything through this system to start to change how forces are distributed through your body. This doesn't mean that one position is good or one position is bad. It's just the strategy your body is using. And as you flow through movement, your body's going to change and push through different pressure points, different aspects when you're walking, when you're running, when you're moving. It's not that any of these are bad. However, if you're reaching a point where you're getting injuries and they're getting overloaded, we want to start to see the tendency for your body to fall into one of these 2 patterns of movement, because quickly and easily we can change pressure at the foot by changing pressure at the pelvis or the ribs, which we're going to do in day 1 of this workout. So we're going to play around with this position of ribs and pelvis and start to see how that changes your foot pressure. So this is actually the same picture of the girl that was from earlier in the presentation. So we're going to zoom out to her picture, but the foot pressure stuff feels so small, and until you start focusing on it, it seems like insignificant. You're like, who cares where my foot is pressurizing? But in this case, if we look at her feet, she's got a downward positioned arch. And again, the arch needs to be dynamic, but we're looking at just static and standing, what her baseline tendency for position is. We have this arch going down and we have this arch coming up. When we look at how that shows up in the body, it shows up as this cascade of compensations everywhere. Many people join this program because they feel like they have like 50 injuries and they're like, I got a million things wrong, everything, everything is broken. I'm here to tell you that it's unlikely you have a million problems. It's likely that you have 1 or 2 spots that are problematic that are creating this cascade of compensations through the system. The interesting thing about this client is she was pregnant. So what ends up happening when you're pregnant, here's a little side tangent, but the hormones in your body change the laxity of your ligaments. And so you will have more motion flowing through your body. If you are perimenopause or menopausal, it's going to create stiffness in your body. And so those are just like a baseline consideration that we also take into consideration when we do the full picture. But these problems likely started to amplify on her because of how much more movement was just pouring through her body and the fact that there was more load coming through. Because you can get away with a lot of compensations. Your compensations are doing you a favor so that you can keep going. But as soon as you have hit a point where you can't compensate anymore, this is when problems start to pile up. Highlighting this again, just it's unlikely you have a million things going on. You probably have 1 or 2 things that are creating problems through the system, and your body has created these automated compensations. When we can bring your awareness to these compensations, oftentimes they correct themselves and we can direct our energy at the most effective place to resolve these problems. So we're going to talk about how this kind of compensation trail happens in our body. I like to think of movement, and I use that word a lot when you're looking at me comment on videos, is like pouring or flowing. Movement is like water. Your body is mostly water. We're flowing movement through the system. Your body prefers to flow water movement where it's easy to flow. If it's hard to flow water, your body goes, you know what? Let's just put more over here. It already flows a lot of, let's just put more. And so your brain often perceives where a lot of movement is pouring. So when you're trying to figure out what's wrong with you from the inside, it's hard because your brain thinks of the places that are getting stretched out or under pressure or getting tired. That's where your brain focuses, and that's likely where movement is already happening. This is why we film our assessment, because you might not feel where movement is blocked because there isn't movement pouring there. Your brain is trained and your nervous system is designed to feel when things are happening. Your nervous system is not designed to feel a lack of something. So from the inside, it's actually really hard to figure out a compensation by just going from sensation on the inside. This is where people get into trouble though, because they think that rubbing and rolling and stabbing and like aggressing the spot that is already flowing a lot of force is going to be productive. It's already moving, right? The spot that hurts is already pouring a lot of movement. We have to figure out what it is compensating for. We have to figure out why so much extra movement is flowing to these pain points, especially when we're talking about those atraumatic injuries. Again, those injuries that are not coming from an external force, those ones that are accumulating based on how you move. The thing that we have to go looking for is these rocks, these blocks that are not letting movement pour through them. You will likely not feel them from the inside, but you will see them from the outside. And if we isolate them out by covering up other ways to compensate, which we're going to do in this program, it starts to highlight where you're missing movement. These blocks are intentional, right? Your body has done this because it doesn't trust you have stability here. You've had an injury there in the past. You can also have movement patterns come from past sports or like your life, right? Your body is going to start to take the shape of the movements you do. I just had a hockey player in clinic last week, and I can tell every single person that has played hockey in their life because they'll have this anterior tilt. They're going to have bowing in their legs. They're going to probably have an anterior head carriage and a rib cage that sticks out. There's these patterns that start to accumulate based on what you've done in the past. If you're a dancer, if you're a desk worker, the more movement that kind of pours into your body, the more your body is going to take that shape. So it can happen from past movement, it can happen from old injuries. And honestly, sometimes it happens from just cues that you've gotten in the past that maybe actually aren't super productive, but you just think that that's how you should position yourself. Common cues that I see that create blocks in movement are like pull and lock your shoulder blades back or sit your weight back in your heels. Sometimes we have like cues that have actually created a block for us. An example I put on this page here is talking about skiers or people who wear boots or skates. Um, that's another really great example of people who have problems in their knees or their hips because they've limited their capacity to move their foot for so many years. We're going to bring movement back to your feet. So, learning how movement is flowing in your body and learning where to pour it is what we're going to do over the next 4 days. We want to start to listen to the sensations that you're feeling in your body and start to gather information from them instead of fearing them. So we want to not, and I'm adding this slide is actually a little extra for you guys. We talk about this in the posture revival program. Generally in the 4-day fix, I just talk about where movement is distributing, right? Like when you go to squat, there's a lot of movement in your foot. There's not a lot of movement in this hip. And we kind of stick to this foundation of where is movement pouring and where is movement blocked. The other thing that we talk about in the posture revival program, and I bring this up because it's so important to talk about your feet, is what is initiating your movement. So once we kind of get through the weeds of is this moving, is this not moving? Do we have the mobility or do we need to work on it? Do we need to create stability? Once we have this checklist done, we need to start looking at how your body is actually initiating movement. And I'm going to show you why the feet are so important for this in this next example. So what we have in this video is a client that went through the posture revival program. She came in with a lot of back pain. She had uh, a previous ACL injury. Off the top of my head, I can't remember which knee it was, but you can see her pointing in this video. She's like, my back hurts, my ribs hurt. You can see her brain is going where movement is flowing, right? So in her mind, from the inside, she's like, I have a back problem. This is a problem. My hips are tight and I got a back problem. So we came after this back problem, but we did nothing to change her back. What we did was change how she initiated movement. We did not add more mobility. We did not sit and stretch out her hips. We changed so that she initiated the movement out of her feet. So her feet were initiating the motion above. All of the back pain goes away. Back pain was where movement was pouring. We needed to figure out where movement was missing, and that movement was missing in her feet. We initiated the movement out of her feet, and it completely changed where force was accumulating in her body. So again, that's a little extra. We go into that in the 8-week program that I do, but I wanted to give you guys this idea that make sure you're targeting the right thing. Because if you're not, you're going to be spinning your wheels and wasting your valuable time and energy. So let's navigate pain a little bit. Just coming off of that, remember, don't go quick to judging the pain point. Think about how movement is flowing first. That pain is not going to be a stop sign. We want to take that information and start to give you tools to modify and feel out why that pain is starting to accumulate. So we're trying to figure out the mechanism. So as soon as you have a movement that hurts or relieves your pain, that is valuable information on what is going to be the solution for you. So don't stress if you have something that heightens your pain or decreases your pain. We just are collecting information so that we can start to take shape as to what your specific plan is going to look like. Because we're not doing foot exercises for foot injuries. We're doing your rehab exercises that your body needs to change how motion is flowing in your feet. So instead of thinking of panicking when you are experiencing pain in an exercise over the next couple of days, we want to use it as like a guide. What part of the movement did that happen? And if I change and listen to these cues one more time and start to shape shift how my body is creating that movement, can I change how that feels in my body? When we start to uncover these areas that are being guarded, sometimes pain happens, right? There's a reason why your body is pouring this movement. So we want to be really calm and patient with your body because sometimes when we unpack a compensation, we find an injury that you didn't know you had because your body's been guarding it, right? So as we experience these movements, don't stress if you're like, whoa, this is new. I didn't know my shoulder or my back, or I didn't know this was going to tighten up. We're trying to figure out what your body is compensating for. Your body is very smart. So there's a good reason it was probably flowing movement that way. I highlight this idea again that we need to create stability before we open up more ranges. So over the next couple of days, we're not doing a huge amount of mobility drills because if we open up too much motion and we take out your body's stability plan, that compensation pattern it has, we open you up to injury. And so what we want to actually do is create new pathways of stability as our starting point before we open up more range of motion we have to stabilize. That's a really important one for you guys to take as well. If I had the option to go back and highlight a slide or a thought, it would be that. It would be patient in how quickly you open up and distribute motion in your body because there is a reason your body is flowing movement the way it is, and we want to calmly and thoughtfully approach it, right? We don't want to be like, I'm not doing that movement because it hurts. We want to be like, I'm going to dial it back and I'm going to see what the actual sensation is. Hurt is not a sensation. Pain is, sure, I'll give you that. But it's like, is it sharp? Is it pressure? Is it stretch? What is the sensation? When do you feel it? And where does it happen? That is what mindful observation is of this pain. We need to define what and where and why and what the conditions of the body are when it happens. Even better if you can start to be like, oh, I changed the position of my rib cage and suddenly my plantar fascia pain went away, right? Like this is the stuff we want to start to collect information on because that's going to give you your list of things you want to work on to rehab stuff. On the other end of the spectrum here is like mindlessly pushing into pain. We are talking knees and we are talking ankles. And for many tendon rehab protocols, the thought previously, well, sometimes it is, but is to push into pain. We really want to be mindful in how we do that and make sure that we are actually flowing movement effectively before we force even more motion into it. Yes, movement, yes, strength is going to create adaptation, but we want that adaptation to be productive in the long run. So don't just mindlessly push into pain. Let's start to use this sensation as a guide as to where to direct your energy. So we'll pop into the 4-day fix program quick here, and then I'll open up the chat again so we can all talk. But let's see here if I got which page do I have open here? Okay, so this is the program page that you guys are seeing right now. So hopefully you've had a chance to watch the getting started video, you download the scorecard, and you saw the movement assessment on this page. After this call, I'm going to open up another button here that's going to say day 1. So I'm going to give you day 1 today, day 2 tomorrow, day 3 on Wednesday. Each of those days is going to come with a video. Day 1, we're going to talk about that rib cage pelvis and like the containers of your body and the foot pressure and start to see how the rib cage and pelvis are influencing the pressure through your feet. I give you guys little cues of things to explore. So when you're writing in like how did day 1 feel, use these little prompts to kind of define like what you write down. I keep it pretty open, so you don't have to go into an incredible amount of detail, but you can just observe like what changed, what felt better, what felt worse, what felt challenging. All of this stuff is going to give you information that we'll chat about on the closing call. Here's 2 relief drills. So this one is 9 minutes, this one is 5. So they'll take a couple minutes. You can do these in and around the same time that you do this if you have time. If you have time and you're like, I've got an hour, I would suggest go through workout 1, do this relief drill, go back and do workout 1, see if anything changed. Go back, do that plantar fascia 1, see if anything changed. If you do not have time, you can plug these in at any point in time through the day. But we want to gather information on did this feel relieving or did this feel aggravating? So altogether, if you were to go through these once, this will probably take like a half an hour between the writing. So that's about the time commitment that you'll have for each day. Day 2, we're going to talk about initiating rotation, just like I showed in that slide of like, are we initiating it out of the shoulders or are we able to actually create rotation at your foot? This one's going to be really important for paying attention to sensations because whatever moves first is going to be where you feel it. So if you go into that movement and you're like, oh, the inside of my knee hurts, that is where rotation started. Bring it down to your feet. Bring it down, bring it down and then pull it up. So this one, I have these little prompt lists, and we have 2 different kind of lessons. I think this one's a little bit longer, but I wanted to give it to you guys. This one's a little shorter. And then we got day 3. So day 3 is going to look a little more like squatting. So I've done some different styles in this 4-day fix, but I want you guys to leave with the ability to kind of squat with less pain and bend your knee. So this third lecture is actually about creating tension in the squat. So it's a little less about the movement distribution and a little more about how you're actually creating that motion. We're going to talk about breath and we're going to talk about the activation in your foot as our relief drills. So those are going to get linked day by day, starting today. I'm going to dig into the chat. Sorry, I was in the zone. Marianne, yes, there is a forward and backwards for the 1, 2, 3. So when in this little workshop, we're talking predominantly about rotation. In the full like 8-week program, we do all planes of motion. The forward and back is, if we think about what I chatted about, when you go forward into your foot or backward into your foot, there needs to be internal rotation. So if we have a hard time keeping those 3 pressure points, I usually, even if we're talking about like someone who's sitting forward in their foot or sitting back in their foot, we start with rotation to ensure that we actually have the capacity to keep the foot pressurized, and then we go into that forward and back. So that's kind of why I picked rotation as the starting point. We saw Steph recording. Oh, good. Yes. So just catching up on these chats too. So it would be the same for shoulder injuries. I'm just chatting, looking at, I can't pronounce the name very well, but the question is, would this be the same for shoulder injuries? So yes, I did a 4-day fix for shoulders in the spring. Usually my suggestion is start from the injury and move away from it. So if we're talking about feet and knees, the biggest container that comes next is pelvis. Pelvis mimics the position of the rib cage. If you're just sitting here, you lift your rib cage, your pelvis will go forward. You drop your rib cage, your pelvis will go back. Those two things work together. If we are talking about a shoulder injury, usually we would start from the location of the rib cage and the neck and then kind of work our way through the rest of the system. But as you guys could see, we can go either way, right? And that's why we don't want to get super attached to the area where we're feeling pain, because any flowing of movement through the system can start to accumulate that pain somewhere. And especially for these types of injuries that are not from a force external to you hitting you, it's coming from the way your body is accumulating force. The older an injury is, the further the compensation will trickle. So if we were thinking about the case studies, Jody, who helps with this course now, we're doing dental hygiene ergonomics now because she was so pumped about her neck getting fixed with her knee. But her ACL surgery was probably like 10, 15 years previously. And she was just like, I don't know, I got all this neck pain. I've been working as a dental hygienist. I guess I just have neck pain. We've readdressed how her foot was pressurizing because her brain kind of shut down that area. And that can happen after surgery, right? Your brain goes, I don't trust this. Let's move this force somewhere else. Year over year, the longer you do that, the further these cascades of compensation are going to be. So it starts small and then it gets bigger over time. That's why I really strongly suggest, if you do hurt something, don't just leave it and go, oh, the pain went away. Because the pain went away because your body moved that somewhere else, right? It's like I rolled my ankle, but in like 3 or 4 days, it felt okay. It's because your body stopped using your ankle. And so what you're going to end up with is like, whoa, but then a month later, my back hurt. And then like 2 months after that, my shoulder started hurting. That's how these things happen. That's why pain is really not the only thing that we want to look at. We need to see movement from the outside because pain sensitivity is changing. It's a moving target. So it's not a very accurate depiction of where you need to put your energy a lot of the time. So with that being said, look at me keeping on time. I'm right. Does anyone have any questions about the presentation, or any questions about anything that's coming up over the next couple of days? You can either pop them in the chat or you can unmute yourself and we can chat. I'll touch on, I don't know if anyone's waiting to type in something, but I'll touch on, I touched on it briefly, but I'm looking at a couple of you that I've had a chat about hormones with in the past month. Um, and I bring this up because of plantar fasciitis. As you enter perimenopause and menopause, your estrogen levels change. And so we also want to be conscious of if you have it on both sides or one side. Because sometimes if you have a pain that is happening on both sides, that can have to do with something in the system, right? So how your body is actually healing. So whether that's like hormones or if you have some sort of hypermobility syndrome, we want to be conscious of the pattern of pain that you have. You are more likely to have something relating to like hormones, digestion, etc. if it's happening on both sides relatively evenly and it has to do with like the volume that you are doing. That's going to give us an indication it's probably how your body's healing, not necessarily how your body is distributing movement. So we keep that in the back of our mind. It's a little outside of the scope of this little 4-day fix, but we do talk about it in the full posture revival program. We do like individual assessments and we kind of create plans based on what everybody has individually when we do the full program. For the purposes of these 4 days, we're focusing on movement and distribution of load. But I put that out there for you guys to just understand that that's a consideration too. And outside of hormones, even in terms of training volume, like if you're in here and you're working out in the gym, we also want to be conscious that if you just like increased all of your training volumes, there is a tissue tolerance component to this too. So we want to be conscious of like how long you're sitting through the day is going to put force through your knees, how much you're squatting, how much you're exercising. But what we want to target in the next 4 days is actually how we can improve the flow of movement so those hot spots don't happen. But I keep that in as a consideration for a couple things too. Cool. So again, I'll leave it open if anybody has any questions, but right after this, I'm going to give you guys access to day one workouts. And you'll again have the scorecard. Any questions you guys have as you go through these movements, put them in the Facebook group. So even if you are doing a movement and you're like, I don't know if I'm doing this right, just film yourself doing it and put it into the Facebook group. I'll be pretty responsive over this week. So I'll be there to give you some feedback. So if you don't know what's happening or if you're doing an exercise and you don't know what it means, put something into the Facebook group and I'll jump in there and give you guys some feedback on that. Just to confirm. Yes, so Kelsey, just to confirm, I'll share this again. I know that everybody has a busy life. Me too. Um, I would say this. If time is not a problem for you, you lucky person, I would do day 3. So it'll be like 10 minutes. Then I would do one of these 2 drills, go back and do it again. See if it changes anything because the relief drills match the movement patterns that you're going to see in the actual workout itself. If you do not have time to do that, I would just do this. And if you have time to do a little bit of both, I would probably plug this in and then you could even play around with doing these as like warm-ups before your workout or like yoga class or something that you're doing. So those are a few different options. For the most like direct feedback on is this changing things, you would do it like paired with these day 1, day 3 kind of workouts. But anything that you guys can do is great. If you can only do one thing, if you only have time to do one thing, especially over the course of the next 4 days, because I'm going to be giving you guys lots of feedback, just do those workouts. Yes, you can do the relief stuff, but if you only have time to do one thing, do the workouts, get the feedback, because on Thursday, we're going to talk about what all this means in your body and how you can kind of shape out that rehab plan based on the information you get out of those 3 days. Day 2. Everything will be on that program page. I'll put it again. I think it's pinned in the Facebook group. Let me shift this. If you go to the Facebook page, open home. Yes, they do. If you go, is it featured? Oh boy. I use Facebook just for these. I should do it more often. So then I get better at it. Featured. There we go. So featured, if you go to the top here, you go featured. This is the page that like has all the things on it. So that's going to be the ticket. Save that one, keep that one. That's where everything is. So again, Facebook group, you go featured, and this is where that is going to be. You will also get email. So we'll send out an email when we put that out. We try to keep everything in the Facebook group just because emails are, people get lots of emails. But we'll send out an email too for those of you who are not in the Facebook group. And if you can be in the Facebook group and you are not, please get in there because then we can talk to you more easily and give you feedback faster. I think that is all. So yeah, we'll send out the email. The link to that actual page will remain the same. So we'll drip out a new day. I'll put the next day. My dog's having a crying fit in the background. I don't know if you can hear that. We will send an email every time we release it, but it'll be in the morning that we'll release the new workouts. We drip feed them in just so that you have time to sit with the exercises because sometimes if we give them all, everybody does all of them. And then the next day they go, that hurts. And I go, well, you did everything. So I don't have information to get to give you. So the reason we do 24 hours apart is like, what does it feel like during? What does it feel like afterwards? Where did force accumulate in your body? That 24-hour period, all of that gives us information. So do try to be day by day. Don't try to plug it all into one day because that's not going to give us valuable information. If we do have something improve or you have something get worse, we don't know what it was if we did everything. So we really want to take each day to gather information about your injury and what you specifically should be working on. Thursday's call is going to be at noon. So Thursday's wrap-up call is also going to be at noon. In the fall, I did it in the evening. And although my dog is crying in the background, my child was running around in the background. It was a little challenging to focus. So you guys get lunch hour lives. Cool. Well, I'm super excited. I have looked through all of your guys's video asks too. So I'll try to plug in just some information in the Facebook group over the next couple of days. You'll certainly get all of the workouts and stuff delivered via email if you're not in the Facebook group. And yeah, if you guys have any questions along the way, that is where you're going to plug them in. But I'm excited to get going. Let's fix up those knees and feet. I see it already. I've been watching your movement assessments, y'all. We're going to have some big wins. I can tell you that off the hop. I am excited. So that's a wrap for today. I will chat with you guys again on Thursday and yeah, see what we can fix with these feet and knees.
This is the official wrap of season 1 of the Doc Wishloff Podcast. We're taking a little break over the holiday season and we will be back in January. I'd encourage you to go binge those episodes that exist and we'll be back with more fresh content in 2025. Thank you guys for listening. It has been a blast. Once again.